Namaste everyone. So today we're going to practice chair yoga. I have designed in such a way that it should be safe and effective for your all the trimesters. So there are different changes in all the trimesters. In the first trimester, you don't have energy, you feel sleepy, you have a headache and constipation and different symptoms. Your second trimester is most energetic and safest. Third trimester, you have your belly is increasing and a lot of digestion issues and sitting problems. So I have designed this session so that you can just simply sit on the chair. Any kind of chair is fine. Even the sofa is fine, but make sure you're not sinking down too much in the sofa, and you just sitting. You can sit straight with the comfortable posture, but still I would suggest you to ask your doctor if you have any kind of complications. Please do not practice any physical workout. So let's just start the practice. Okay, so you can just simply sit with the back straight, resting feet at 90-degree angle on the floor, and just join your palm in front of the chest. Close your eyes. Deeper inhale through the nose, exhale through the mouth. Inhale through the nose, exhale through the mouth. Last one. Inhale through the nose, exhale through the mouth. And release from here. Slowly open your eyes. Now we're going to start with the neck and shoulder work. So let's start with the neck. So I'm avoiding neck rotations because sometimes some female they have cervical issues and neck pain. So I'm just avoiding such kind of things. So inhale. So throughout the session you're going to inhale and exhale through the nose only. So inhale in the center. With exhale, you're going to turn your neck completely to the left side. Make sure your chin is not down, it's just up. And you try to bring your chin in the same angle of your shoulder. Deep breath back to the center. Breathe out, go to the right side. You can feel you releasing the tension from here. Inhale back to the center. Exhale, turn to the left. Inhale, exhale. You will feel that you can rotate your neck in a better way, and then just release. Now you're going to take your left hand, so you can grab your chair, okay, but this is not compulsory. If you don't have any comfortable handle, so you can just take your left hand behind you and then take your right hand up at the left side of the head, and you're going to tilt your neck to the side. So I'm grabbing the chair. Why I'm doing this? So that my shoulder is down and relaxed and I'm not lifting my shoulder. Then automatically you reducing the stress, space, and then it's not effective to give you any stretch. Okay, so just hold and tilt to the side. Through breathe out. Inhale, deep breath back to the center, and you're going to change other way and tilt. And release from here. Now we're going to do some shoulder rotations. So you're going to lift your shoulders high and close to your ears and then taking them back, creating the circles. Just 3 times clockwise and 3 times anti-clockwise. Just rotate. Keep breathing. Sometimes you have hard time for your breathing, so you have breathing issue. So just keep on trying. If you find it hard, you stop, you take a normal inhale and exhale, and then you can restart the practice again. Okay, so let's do other direction. Even though sometimes when you have emotional changes like stress and anxiety, and then you practice neck and shoulder, it work amazingly because your stress always collect in this area. It becomes really tight. Okay, release from here. Now you just going to take your right leg to the right side straight way, but it should be your comfort zone. Sometimes it's hard for you to move your leg in the side. Okay, so just take to the side and then slide your right hand down and left hand stretch over your head. So you're creating space here in your uterus for your baby to move freely. And then breathe out, release from here. Now you're going to change to other side, taking your left leg to the left side, keeping the toes up and straight your knee, sliding your left hand down and right hand stretch over your head. Keep breathing again. You can feel in your obliques, you feel in your lats. And then release from here. Now bring your feet at the same position. Now we're going to do cat and cow position. Cat and cow pose is really effective because it works on your whole spine. It helps you to breathe more openly, allows you to open your chest, which is going to help uh, in the blood circulation process towards the uterus. Also, it's going to help you to oxygenate your cells, sending a lot of blood circulation towards the head. Anyway, there are 31 pair of nerves connected to your spine, which is going to send the blood throughout the body. Okay, so you're just going to bring the palm on the knee, and so this is seated cat and cow. Okay, so then take your shoulders back and chest out. Look up. Exhale, hinging the back. You don't feel that good, so you don't need to go deeper. Keep it gentle. So I show you from the side. So if you're just going to sit this way, so then roll your shoulders back, chest out, hip out. So take the hip backward, chest out, and look up. Breathe out, head in. Inhale. It's going to help you with your back pain also, which start coming from the second trimester mostly and until the third, even afterwards. So keep doing that. Do it for 5 times. Just 2 more. Inhale. Exhale. Breathe out. Inhale. Exhale. And release. Now we're going to do this is called pigeon pose. Okay. So bring your right foot on the left thigh and instead of bringing the knee towards the chest, we can do that also, that's fine, but the most effective one is when we push the knee down. Reason, because during the pregnancy already your body posture in such a way that you sit a lot of times, and your body posture in such a way that you are overstretching your glutes already, and now if you're doing that again you are overstretching only, so it's not going to give you big benefit. But if you're just going to push the knee down, it's going to open up from here. Okay, and then you're going to relieve in, if you have any kind of hip numbness or sciatica pain or any leg cramps you have, it's going to help in that. So just you can bring the feet closer and then push the knee down. You can feel here, and then inhale up, not too much. Breathe out. Breathe in. Breathe out. Push the knee down. Okay. And then take the foot forward if you want, um, just to go to the deeper stretch. Okay. So, but don't try too much in your third trimester. Okay. Bring the palm, one palm on the foot and one on the knee, and just bend from the lower back. So I'm showing you from the side. Make sure you're not doing this. Okay, you're not doing this. You just doing this. So you taking your hip backward, chest forward. And in this way, you will feel the stretch here at the outrage of the hip. Okay, release now. Let's do the pigeon from other side, from left side. Bring your left foot up and then push your knee. So even I'm feeling a lot of tightness in my left hip because um, we have to sleep at the left side mostly, and the left side becomes really tight. Okay, and then up. Exhale, breathe out, down. Inhale, up few times. Exhale, breathe out. And release now. Slightly take your foot forward and then shift your body weight forward. You can feel in the outrage of the left hip. Make sure you're not pushing yourself more than your limit, because pregnancy is not the time to challenge your body. It's the time to just adjust and listen your body. Release now. Bring your left foot down. Now we're going to do warrior. So take your right leg to the right side. Sometimes you feel cramp here in this position. If it's hard for you, slightly take the foot forward and gently bend your knee. Okay, that's up to you. Now taking your left foot out. Okay, and then from here you're just going to drop your left elbow down and right hand stretch over your head. Warrior A, Veerbhadrasana A position. So you can see my left foot is turning this side and my right foot is in the comfort way, just facing front. Okay, now let's do peaceful warrior. So you're going to slide your right hand to the right side and left hand stretch over your head. Again, you don't need to go too much, just stay here. Breathe out, release from here. We're going to change to other side. Now bring your feet in the same position, and then this time take your left leg to the left side and then right foot out, facing out, and then from here drop your elbow down. Sometimes you not feel comfortable to reach and drop the elbow down. In that case, you can just bring the palm down and then you do this pose. Okay, so then from here drop your elbow down and up. Look to the middle of the palm. Release from here. Let's do peaceful warrior. Slide the left hand back, right hand stretch over your head. Keep breathing and then release from here. So bring the feet at the same position. Now we can work on the knee mobility. Okay, so grip underneath of the thigh and then lift up, and then you're going to straighten the leg And at that time you can try to squeeze your thighs. Okay, it's going to strengthen your knee. Also, you're working on your thigh because anyway your muscles, you need strength from your muscles also, so that it can support you from the core. And at pregnancy time your core start becoming weak. Okay, exhale down, inhale just 3 times, squeeze the thigh, breathe out now, inhale, and then down. Now you'll be going to change from the left side, grip underneath. You can slightly lean back also if it's hard for you. Just try to squeeze the thigh, straighten the knee as much you can, and down, inhale, exhale, inhale up, and then release from here. Now you just open your legs wide. We're going to do goddess pose. So here you have a variation, a slight challenge for you. So if you are feeling low energy, stay here, joining the palms, pushing the knee back. If you feel better, then you can just try to lift up and up. So make sure you're not leaning forward, and you just try to go back and pushing the knee back. So you're not bringing the knee forward. Just take them back and hold. Just 3 breaths. And then all the way down. Okay. Now we're just going to do a little bit of breathing, so you can just take complete support backward, and then bring your left palm on the chest, right palm on the belly, and inhale through the nose, exhale through the mouth in 3 counts. Inhale in the 3, exhale. Now bring your palms down, and now bring your right thumb on the right nostril. We're going to do Anulom Vilom, alternate nostril breathing. And breathe out from the left just to calm down your mind. Make sure you're not holding the breath in any breathing practice. Okay, so right thumb on the right nostril, breathe out from the left, breathe in from the left, close it with the ring finger, breathe out from the right, breathe in right, out left, in left, out right, in right, out left. Resting palm on your knee. Just normal breathing, normalize your heart rate. Join your palm in front of the chest. Let's do Om chanting once. Shanti, Shanti, Shanti. Rub your palm, touch your face, and slowly open your eyes. Thank you.